What's the average penis length? Are traditional self-pleasure techniques harmful? What about the popular folk belief that you can strengthen an organ by eating the same one from an animal? Does it actually work? How can guys scientifically improve their gun's performance? In this episode, we'll use a gun as a metaphor and step into the halls of science together. A paper in the Chinese Journal of Sexology shows that among Chinese men aged 16 to 57, the average length of a flaccid penis is around 7.42 centimeters and about 12.42 centimeters when erect. But fellas who are a little on the shorter side shouldn't be too anxious, because whether a gun is any good ultimately depends on whether it can be used to shoot. Whether you have a handgun, a rifle, or a sniper rifle, the main steps to firing are always turn off the safety, then load the chamber and pull the trigger. When a guy is emotionally moved, when his mind starts to wander, it means he's turned off the safety on his handgun. When blood rushes into the corpus cavernosum, the bullet begins to load into the chamber. And as for pulling the trigger and the bullet firing, I think you can guess the rest. So when does it happen that the gun can't be raised? In other words, erectile dysfunction. To put it bluntly, it means there's no bullet in your gun. Not enough blood is entering the corpus cavernosum, so the bullet can't be loaded. This is mainly because the safety can't be switched off, or there's a problem with the gun itself. Being unable to switch off the safety is one of the common triggers for ED, known as psychogenic ED. Anxiety, fear, fatigue, stress, depression, low self-confidence, and many other negative emotions can all prevent that internal safety from being switched off. It's not that your gun is bad. Even the highest performance gun needs its safety off, right? Every skilled marksman should have a strong psychological constitution. It's not just about being calm and collected. And most importantly, you have to believe in yourself. If the gun system itself malfunctions and you can't get a bullet into the chamber, that's what we call organic ED. Among these vascular problems are a common cause of ED, like atherosclerosis, narrowing of the arteries, and so on. You can think of it as a problem with the path the bullet takes to the chamber. High blood pressure, high cholesterol, diabetes, and obesity are all risk factors that increase artery hardening, and they can directly or indirectly increase the incidence of ED. Furthermore, as any gun gets older with use, its malfunction rate will gradually increase. And if you don't take good care of it, things like frequent smoking, heavy drinking, lack of exercise, and being overworked will all increase the risk of ED. So how do we fix the gun? First off, we don't recommend trying to fix it yourself. You should go to a proper hospital for a checkup. After all, you only have one gun, but a doctor, the number of guns they've seen and fixed could fill an entire armory. Among the treatments, PDE5 inhibitors are currently the first-line drug of choice. Inside a guy's penis, there's an enzyme called PDE5. You can roughly understand it as, this enzyme is what helps the penis calm down after an erection. And PDE5 inhibitors work by suppressing the PDE5 enzyme, which increases blood flow, thereby improving the penis's erectile function. All those different minus-a-fill drugs produced around the world, they're actually all PDE5 inhibitors. PDE5 inhibitors are not addictive or habit-forming. In other words, you can stop taking them anytime. Of course, that doesn't mean you can just pop a couple for fun whenever you want. First, your gun actually has to have a problem. Otherwise, aren't you just looking for trouble? Second, if there is a problem, you need to see a doctor first to figure out exactly what's going on and then consider how to treat it. What if the issue is that you can't switch off the safety in your mind? In that case, all the minus-a-fill pills in the world won't do you any good. So how can we perform routine maintenance on our guns? Although legends have long been circulating in the wild, like oysters being a man's gas station, or chives being a man's virility herb. But currently in clinical practice, there isn't enough evidence-based medical proof to support these claims. Oysters are rich in zinc, and zinc plays an important role in both sperm and testosterone production. But the problem is most people aren't deficient in zinc. That's because it's not just oysters that contain zinc. Shellfish, red meat, poultry eggs, and dairy products are all common foods that are relatively rich in zinc. As for chives, you can't say they're completely useless because they're cheap and full of dietary fiber. So if you really do feel more energetic after eating chives, then there's no harm in believing in the power of belief. The placebo effect is still an effect after all, and the whole like cures like theory is even more of a stretch. Kidneys are mainly used to filter urine, while the penis is primarily made of muscle and connective tissue. There's no solid evidence to suggest that they can improve ED. Believing in that is worse than believing in chives. At least chives are green and cheap, making the placebo effect much more cost-effective. Some of you might be wondering, if we can't rely on food, What can we do in our daily lives to improve our guns' performance? Multiple studies have shown that lifestyle improvements like regular aerobic exercise, quitting smoking, and limiting alcohol not only improve the efficiency of getting it loaded, but are also beneficial for your overall health. For people with chronic conditions like coronary heart disease, hypertension, diabetes, or high cholesterol, actively managing these underlying diseases can also, to a certain extent, prevent or delay the onset and progression of ED. And one more thing to remind everyone, ED might also be a local symptom of a systemic disease. So if you have any related issues, you should see a doctor promptly to find out the cause. And with that, let's get down to it. Lastly, let's talk about a topic that a lot of friends are asking about. Does traditional craftsmanship hurt your gun's performance? Time for the big reveal. In moderation, it's harmless. After all, even the best marksman needs to get familiar with their weapon. As for how often you should practice, the internet might say a few times a week, but I think that's too arbitrary. Everyone's capacity is different. As long as you feel good both physically and mentally afterwards, and it doesn't interfere with your daily life, you're probably fine. But, and this is a big but, if you ignore your body's limits, overdoing it can lead to chronic prostate congestion, increasing the risk of inflammation in your urinary and reproductive systems, like prostatitis. This might cause symptoms like a bloated or painful lower abdomen, frequent urination, a sudden urge to pee, feeling like you can't empty your bladder, or a weak stream, and even sexual dysfunction. So if you've been overdoing it, you can use these symptoms as a rough guide. If you have similar issues, go see a urologist. Also, another friendly reminder, before you go into airplane mode, make sure to wash your hands. Dirty hands or toys can also cause infections. All right, that's all for this video.